Me. Hello, everyone. Welcome. And we are back. This is Shonda, one half of Prison Break with Shirley and Shonda. And we have a special edition for you on this evening. We are back with Dr. Freeman. We were so graced by his presence the last times, or rather the last two times that he joined us. And so we were so excited to be able to have a really candid conversation with him. So we have brought him back on this evening. He has some really important nuggets and facts that he wants to share with us. And I am so excited to hear what he has to say. I have my notepad ready. I have my pencil ready. You guys can go ahead and start your watch parties now. Like, share, and make sure that you get this information out. You do not want to miss this broadcast. So, Dr. Freeman, how are you? And welcome back, sir.
I'm fine. How are you? And glad to be back. And thank you for having me back. I thought after the first two times, y'all wouldn't want me back, but
No, we so enjoyed just talking with you and your testimony. And you're such an easy person to talk to. I think that might be why you're good at what you do. But we just love talking with you. So we were so excited that you agreed to come back on this evening. I've been doing well. It's been busy. We have already broadcast once today. So I'm so excited that we can come back. Yeah, a second time on today to sit with you. So I know that you have some stuff that we decided that we were going to talk about tonight. So I'm just going to get out the way. I'm not going to even say another word, Dr. Freeman. I'm going to let you have the floor. You can reintroduce yourself for the people who may have missed us the first and second time. And then you can go ahead on in and I'll jump in there with questions when I have them.
okay. Well, thank you. You might want to keep a little hold on the floor though. But again, my name is Edward Freeman, Senior MD. To remind my son to use Junior on his name. But I am a psychiatrist. I specialize, well, actually, I'm a physician. I'm an MD. Physicians there are two types of physicians. There's MDs, and that's what's Doctor of Medicine, and there's DOs, Doctor of Osteopathic Medicine, which we could talk about that all day. But suffice it to say, DOs are given all the same rights and privileges of an MD. So physicians. And I say physician because I have a brother who is a computer engineer and he has a PhD. So he's Dr. Freeman too. So anybody with a PhD is addressed as doctor. And we see that a lot these days now, Dr. So-and-so, Dr. So-and-so. Mm-hmm. So that's why I say physician and not doctor, because dentists are doctors, vets are doctors, chiropractors are doctors, but they're not physicians. So all psychiatrists are physicians. That's the distinction between psychologists. Now, I'm subspecially trained in forensic psychiatry as well. Forensic just means the law. And what we do is take our expertise and apply it to the law. So you could be an you could do expert testimony at a trial. The most I've done really have been competencies and commitments to people to psychiatric treatment. But what I do every day is pretty much adult psychiatry. And that's what we're going to talk about today. So I started out just by telling you the difference. And one thing that people say all the time, well, psychologist, psychiatrist, I don't really know the difference. I know one can prescribe medicine and one can't. Mm-hmm. Well, that's true, but there's much more to that. Again, as a physician, and I'll briefly go through that, you go to medical school. You don't have to have a PhD or an M or a master's. You can have a bachelor's. You go to medical school. Medical school is typically 4 years. Sometimes it's a little more. We'll talk about that later. But after you finish medical school, you go train for your discipline, in this case, which is a residency. In this place, I wanted to do psychiatry. So psychiatry is a 4-year residency. And they're not called interns or residents. They're actually called PGYs, which is postgraduate year, because most residencies are tied to an institution that has a medical school. Not all, but many. So again, for psychiatry, it's 4 years. Now you're getting paid. Now you're not getting paid a whole lot of money, but if you take what you're paid and add to it what you're not paying out for tuition, it suddenly seems like a whole lot of money. But it's enough to feed yourself and maybe a family member or two. So for me, it's 4 years of residency. After the residency, you can do a fellowship if you would like, and that's further specialization. So in my case, I did 4 years of psychiatry residency. Some people go on to become child and adolescent psychiatrists. Some people go on to become geriatric psychiatrists. Some people become forensic psychiatrists. Those are fellowships. In other words, another year or two of training. If you're going to be a general psychiatrist, you're done. You've got your training. Hopefully you're licensed, and you can go out and do what it is you want to do. So I did another year in forensic psychiatry. So that's that thing. So the difference, and in that training and that residency, you're working in the emergency rooms, you're working in a lot of different places. So you deliver babies, you do emergency treatment, you're still first and foremost a physician. That's why somebody says, is there a doctor in the house? A doctor can help with a wound or an illness or even deliver a baby. The last baby I delivered was in a jail. I won't say what jail it was in, but it was in a jail. Wow. And the first thing the nurse says, well, you can't deliver the baby, you're a psychiatrist. I said, yeah, I'm a psychiatrist. Exactly. Call 911. The baby's on the way. I'll have it out in a minute. And it's true. She didn't know I've delivered 30, 40 babies. More than that, I'm not sure. I don't remember how many. And that's in your training.
It's not common knowledge then to most people that psychiatrists are actually MDs. Like you can actually practice like legit medicine and do things that all doctors do.
Well, and it's important because so many psychiatric symptoms have medical causes. And so one of the reasons why you have to be able to do that is someone comes to you and tells you, let's say anxiety. And this has actually happened to me in my career, maybe 3 or 4 times, which some people consider a lot, but I've had people come to me and talk about how they suddenly get so anxious and scared. And when you do a detailed history, 2 out of the 4 actually had a medical condition with their heart. And it was the heart that was causing them to have that sensation, which led to that fear. And if you're not medically trained, you don't really know what to look for. And oftentimes, a lot of primary care physicians miss it because they focus in on the symptom of the anxiety and not start looking at, well, why is it caused? So as a specialist, that's our job to, first of all, differentiate and see, is this really caused by a psychiatric illness or is this just a psychiatric symptom?
So then what I'm saying, Dr. Freeman, is that sometimes if I'm having symptoms, then the cause might be another pre-existing medical condition. And I kind of need to know that before I start looking for someone to treat me for what I think is anxiety. Is that right?
Well, it'd be nice if you know that, but oftentimes people come to us and they don't know that. And okay. That's my point of that is to get you to understand why it's important to be a physician, because so you can look at these things and see what the cause is. Is the cause psychiatric or is the cause something else? And oftentimes it's not it's pre-existing by the time it gets to me, but it's something that could develop recently in life. You know, some people don't know, and the heart condition is what's called the mitral valve prolapse. One of the heart valves in the heart, instead of when it closes, instead of going down, it pops back up into the chamber. And that creates an unusual pressure, and the body sends off alarm signals. Well, the alarm signal is anxiety, or the feeling of impending doom, like something's not right. And so, but if you don't have a medical background, you're not going to have the ability to even start looking at that. So that's why there's more to it than just saying you can prescribe medicine and one can't. One, we have extensive medical treatment. I've done surgery. I've delivered babies. I've treated children. We've done all that in our training.
Wow. Okay, so I think that this is a great point to kind of make that transition that we were talking about the different mental health conditions in which people kind of suffer through and how you deal with those.
So, yes, you did. And we talked prior before we came on the air, we talked about it. And of course, the common ones that everybody talks about is anxiety and depression. And that's just something I see a lot in my practice. People will refer to us from other, and many times from primary care. Now, I want to make a brief public service announcement. I am not here to badmouth or talk bad about any profession. So if I sound like I am not intending to. I'm just pointing out, as a specialist, the kind of things, the higher level of expertise we may have, we need at times to do things. But every branch of medicine is a very highly trained, highly skilled, and ain't none of them easy, including the dermatologists. People, oh, that's so easy. No, that's not easy. That is actually one of the hardest rotations I did was in dermatology, when you consider the fact that they're looking at skin cancers and other diseases. Not only that, the dermatologist treats the largest organ in the body, which is the skin. The skin is not just simply a bag that keeps everything, from flowing all over the place. The skin is an organ. It keeps, it's a boundary between the exterior and the interior, but the skin also does things. It produces vitamin D, it produces sweat, it allows us to metabolize certain things, it helps heat and cool us, it does a lot of different things. It's part of our tactile sensation, and so it's a living, breathing organ. It's not just a sac, and it's the largest organ of the body. So, there's no easy branch of medicine. Now, there may be some doctors that have a cush job, but if you're doing your job right, there is no easy discipline in medicine. So I just want to put that out there because I'm going to talk about how we differentiate differently than other people. And that's the reason why people refer folks to us, is because they don't usually have the expertise to do that.
Okay.
So, having said that, I just want to put that out there before if anybody thinks that I'm saying something bad about another, because I am not. I love my fellow doctors, and especially after having had COVID. Yes. Oh man, I got to say they went the extra mile. I mean, they really did. Now, was it because I was a doctor? Probably not, but I watched them. What little back, and they really, really worked their butts off. And, I think I'm here by the grace of God, but that grace that God gave me was through the hands and the minds of those people. Amen. So I thank them all. I mean, and understand something. They're out there on this front line, standing and facing death every single day. Right. And even facing their own possible death. So amen to all of them. Thank you. Thank you for everything you all have done for us, and thank you for everything you've done for me. So we were talking about anxiety and depression. Mm-hmm. And those are pretty what most people think about. But let's just talk about depression first. The one thing people have to understand is depression is not a mood or a feeling. People say, well, I feel depressed, or I got depressed yesterday, but I'm okay today. Those are moods. Those are feelings. Now, depression is an illness which may cause any number of feelings. People when they think of depression, they think of feeling down, sad, not wanting to do anything, maybe even wanting to die. Mm-hmm. And that's one side. But you can feel any emotion, including no emotion at all, and have depression. So, and there's multiple reasons why you can feel sad. The one thing I tell all my patients is the reason why I ask you so many questions, because I always say, why are you asking me so many questions? Well, because here's the thing. Every medical symptom known to man has more than one reason why it can exist. And every psychiatric system known to man is no different, including many of those reasons are not psychiatric at all. So if I know you have a symptom, my next thing is to evaluate and explore and see why you have the symptom, because it's the symptom in cooperation with why it's there is what gives us a better diagnosis. Mm-hmm. I see people all the time who come in who are feeling down, anxious, irritable, don't want to do anything, easily frustrated, angered, explosive. And I find out oftentimes it ranges from a thyroid disorder all the way over to undiagnosed attention deficit disorder.
Oh, wow.
So but you have to explore and you have to be curious. I'm just naturally curious. When people tell me, oh, so and so, something happened to them, my first thought is, why? What happened? And not to be nosy, but I'm curious. So when people tell me, yeah, well, I'm depressed, I'm sad, my first thing is, well, why? Really, what is actually going on? So that makes it simple for me to to do what I do because I naturally am curious about that. And when
Yeah.
you start exploring, you oftentimes find out not just the symptom, but the cause.
Mm-hmm.
And the cause, and you don't always, but the cause will tell you what type of things going on. And we have what's called a differential diagnosis. So you get all your stuff and they say, here's the most likely things it could be. And that's based on the number one thing you think it is all the way down to the most impossible thing. Usually it's only about 4 or 5 things.
Mm-hmm.
But oftentimes when people go in and tell their doctor, well, I'm sad and I'm anxious, they say, well, I got anxiety, depression. Well, those are feelings. Why do you feel that way? And so that's what I do. That's my initial exploration with people. And, it takes you a lot of different places. It oftentimes takes you all the way back to childhood. A common thing that I hear from people, I want to say, well, you've been feeling this particular symptom. How long has it been there?
Mm-hmm.
So the answer should be, how long has it been there? Typically what people say, well, I've been able to handle it for up until the last 2 years. So it got bad 2 years ago. Okay, that's when it got bad. How long has it been there?
Mm-hmm.
So you see, and then you start finding out, well, blah, blah, blah. And I'm kind of making up examples, but when I was younger, something happened or somebody died or my parents got divorced. And since then I've been having problems. That's totally different than someone who's been doing fine their whole life up until a short recent period ago. Mm-hmm. We're looking at totally different things. They may be the exact same symptom, but we're looking at totally different causes. And what difference does that make? Oftentimes it means totally different treatment.
Mm-hmm. Wow.
I see people a lot who are grieving. Someone they love died. Well, they come in, they say, well, I'm depressed. Why? Well, I lost a loved one. Well, is that depression or is that grief? And those are two different things. Even though symptoms may be similar, those are two different things. I see a lot of people who have a lot of behavioral things going on with them because of traumas they've experienced as a very young child and maybe led on to multiple traumas since then. Their pattern of thinking is such a way that they have a very unstable mood. Now, with an unstable mood, we may treat that with a medicine, even an antidepressant or even a mood stabilizer, but they're also going to need counseling. Mm-hmm. Because a lot of what's going on with them is behavioral. And there's no amount of medicine that's going to change a behavioral problem. The medicine may make it easier to deal with. It may make you less irritable, less anxious.
Okay.
But it's not going to necessarily change what's really causing it, because a lot of times what's causing the problem is the way you think, how your coping skills or lack of coping skills. This is where counseling comes in to help replace those things, reshape those things, remold those things. We talked about this in the very first time we met, people holding on to hurts and pains for years. Mm-hmm. And those things, they grow, they fester, we feed them. And oftentimes people will be angry with someone. And if you really ask them what they're angry about, they can't really tell you. They can tell you in general, mm-hmm. but they can't tell you specifically because they've been so angry so long, they just know they're angry. So,
Dr. Freeman, it's amazing that you worked your way around to this particular point, talking about trauma and the way that we think about it, because kind of on the broadcast this morning, we kind of dipped into the trauma sector where we begin to talk about how after salvation, all things are made new, but you still have to deal with the impacts of those traumas on your life. And so the way that we think about them and conceptualize them continues to keep us sometimes in bondage to negativity and bad behaviors and things like that. So I'm so glad that you kind of dipped in there on your own, not any leading of mine. If you can kind of talk a little bit more about that trauma perspective for just a second, and about how a person's mindset can really affect what happens with them and their behaviors, and holding on to those things, and what that can kind of manifest in their life physically if they don't do anything to address those mindsets.
Sure. And unfortunately, I see a lot of this.
Mhm.
A lot of this. Um, where to begin? I mean, this is something we could talk about. We could do a series on this. So we're gonna have to truncate this.
Sure.
Well, we'll start where we were. Let's say that someone was abandoned, quote unquote. And I use the term abandoned because I'm looking from their perspective. They were abandoned by a parent at a young age, and over the years, the parent has tried, unsuccessfully several times to reconnect with this person.
Mm-hmm.
But this person is holding on to the hurt, harm, and pain so much that even when they try to let the person in, they cannot, because as they try to deal with this, the anger, the pain, the hurt gets in the way.
Yeah.
And depending on how long this goes, this becomes the norm. And oftentimes when this happens with someone, let's say someone's young, let's say a child, maybe 5, 6 years old or even younger, they don't really know they don't really understand what's happening. So what gets formulated in their head gets passed on downstream in their mind.
Wow.
And so, you'll hear things, and I'm putting together some factitious things with some real things to protect the innocent, but to try to get, you'll hear like, well, they abandoned me. Well, what do you mean they abandoned you? Well, they left me because of this, that, and the other. Well, did you ask them that? Well, I don't have to ask them. Well, if you were a child and they left, do you know why they left? I don't need to know. They abandoned me. Well, did they abandon you or did they just leave? Because those are two different things. Well, it doesn't matter. It's the same thing. No, it's not. If someone left because they had to leave and they did not want to leave, then that's not abandonment. Mm-hmm. Now, it may turn out emotionally to be the same for you, and I understand that, and we're not trying to say that it doesn't negate your feelings, but motivation to why somebody did what they did is very important, because maybe they loved you to death, maybe you were one of the most important things to them, but for reasons beyond their control, they had to do what they had to do.
Wow.
And so I always ask the question, do you truly know the story?
Mm-hmm.
Do you know the story of your own history?
Right. Which most of us don't.
We don't. And so many people are so caught up in the way they feel. They're done. This is how I feel about it. Here is the truth. Well, how can you have a truth without facts? And again, but also they get defensive. Well, you're trying to defend them. No, I'm not trying to defend them. As a matter of fact, if you listen to the truth, you may find out you're 100% correct and find some more things to dislike them for. But the thing is you need to know the truth. And so the hard part, though, is to put down that emotional barrier that one is built up. To be able to listen. It's very difficult. But because you have this barrier, it affects you downstream in especially your whole emotional life. Many people's emotional life is stunted. Their growth, their emotional EQ is low.
Wow.
Because they're so caught up in this anger, this bitterness, this rage.
Mm-hmm.
And they're not able to grow much. Many people develop all kinds of things, eating disorders, body image disorders. Mm-hmm. People know the low self-esteem, the daddy issues, the things of this nature.
Yeah.
And and here's what I tell people, here's something you need to understand. If this person affected you that much and they're willing to reach out to you, you should listen to them. Why? Because clearly they're important to you. They don't mean nothing to me. Then why are you feeling this way?
Right.
Because the opposite of love.
Why still be angry? Why still be hurting?
Yeah. And the opposite of love is not hate.
Yes.
The opposite of love is indifference.
Yes.
You know, when you love someone and they do something that hurts you, it matters. And it can matter enough, it can be strong enough that it could produce hate. But when you don't care one way or another, then you don't feel anything. So I said, so, you know, I don't use these words, but I say, you know, I think methinks you protest too much, because if you really didn't care, you wouldn't be hurt. So it's going to take a great deal of energy and bravery to get beyond yourself to listen. And then you have to deal with the other person who may feel guilty, who may feel, you know, a lot of things too. So everybody's dealing with all their emotional baggage, and nobody can put it down enough to talk to each other and to truly tell them the story.
Right. That's good, Dr. Freeman. That's so good. What about people who are holding on to this anger and this hurt, but the other person is not willing to have a conversation, or they're not apologetic, or they're not available? What about those situations?
Yes, we have those too. And unfortunately, those people reinforce the other person. If you're not willing to communicate or apologize or whatever, you reinforce the other person's behavior.
Yes.
That what I'm feeling is true. However, let's just say it is true. What is it doing to you as a person? What is it doing to your psyche? What is it doing to your development? And if it's detrimental to you, if it's destroying you, if you're coming to see me because of all this stuff, then here's the thing we understand. Regardless for if you're right or wrong or not, you're going to need to put that down.
Okay.
And this is where forgiveness comes in.
Good.
And this is the thing that people don't understand about forgiveness. Forgiveness isn't about the person you're forgiving. Forgiveness is about you putting down this baggage, putting down this hurt, harm, and pain. Be it real or not, it's real to you. It doesn't matter if you misinterpreted something. If what you think it is hurts you, then you've been hurt. Yes. Period. So if you can forgive, but then what is the thing? Oh, no, I will not be ignored, or no, I'm not going to act like it didn't happen. We're not saying that. That's not what forgiveness is. Forgiveness isn't forgetting, nor are we saying I'm going to forgive but not forget, because then you're still holding on to it.
Yeah.
You really need to let it go. Because you, first of all, you can't change the past. You can do nothing to change the past. However, you can change how you respond to your past and how you look to your future. Okay. And this is part of generational curses. This really, truly is. If you think about this, and I'm going to use a very stereotypic example, so I hope I don't get in trouble. Oh, no, because it's true. Poverty. Yeah. Poverty. A lot of reasons why people are in poverty. There are lots of different reasons. But part of it is, if you refuse to do something different than was done before, you're going to get the same result. Right. Good. And one of the things, and that's one of the things that all the wealth builders, all the people that talk to people about getting out of poverty, those that really are really what they start foundationally. They start with your thinking, how you think about where you are and where you want to be. Because that's where the generational curse comes from. You have a mindset that you refuse to change. And even if you don't change yourself financially, if you think differently, you will be different.
Yes. Good. Man, Dr. Freeman.
Woo, so this is the same thing here with this. If you want to stay, as my wife likes to say, who hurt you? I love that. That's such a catch-all phrase that you just got to know my wife. She's so quiet, but she's so deep. You know, still waters run deep. Yeah. Who, child? But she'll say something, and of course I understand her, so I see it in 4 dimensions. But she said, "Who hurt you?" And what it means, why are you like this, and why are you staying this way? And it's the same thing. You know, this is a curse. If you hang on to this, this is going to deny you. First of all, it's going to deny you for so many blessings that God has for you.
That's good.
Because remember what I now, you probably don't remember because I barely remember what I say. But when God has something for you, nothing in existence can stop it except you. Except you. You can shut it down in an eye blink. Nothing else can. God probably won't, and nothing else can, but you can. And so when you're so turned off, turned in, and amped up, you're not able to receive the things in your life, and you're not able to move forward. So this becomes a curse because you can pass this thinking, this emotional being onto your children. You can have a series of ruined relationships, be it interpersonal, be it a lover, a family member, or what, and it just keeps going on and on and on. And I see it every single day. Every single day. And I know you see it too in your counseling, and sometimes people have been at it so long, they don't even understand. They don't connect the dots.
Mm-mm.
They don't see how being angry about this has led you to constantly having problems in all your interpersonal relationships. But that ain't the same thing. Well, it may not be the same thing, but understand. And so, we have to show people this. But if they forgive, first of all, how are you going to expect to be forgiven if you don't forgive? But if they forgive, they are going to be set free.
Yes.
They're going to still have problems. They're going to still have, they're going to still have issues. And sometimes they need the help of a professional to help kind of get things back on track. But if they start forgiving, they start healing immediately.
Yes.
And I always tell people, if you ever put that down, I don't ever worry about you picking it back up. And somebody said, why? I said, because you can't. It's just that heavy.
Wow.
You won't be able to pick it back up. Now, if you don't ever put it back down, if you don't ever put it down, you can carry it around with it. But if you put it down, you won't pick that back up.
So. Wow. Wow, Dr. Freeman. Wow. It's so interesting. This morning, the topic that we recorded on was talking about forgiving fathers. And so we were really kind of discussing, I know, it always seems like you come in on that topic.
Why y'all be talking about me? No.
We weren't talking about you. It just happened to kind of go that way. We had a first-time author who came on, who discussed her journey with her dad and what she kind of went through and how she kind of went through the process to heal. And she began to talk to us about all of these things. And she has a really impactful testimony. And so we talked about that this morning. And then here you are talking about generational curses and about how they impact us, and holding on to those things keeps us in a state where we're lashing out at people and we're angry at people, and we have all these behavioral issues and other things that come from holding on to this pain that happened to us in our past, when really God is asking for us to forgive and to release people and to release our own hearts and our own minds from carrying this heavy weight and burden, because that's what it is. It's a burden that we're choosing to keep on ourselves, and it really keeps us down. And so if you can kind of talk about how that can move into a physical manifestation of problems and issues, that would be amazing on today.
Sure. I mean, that's simple. Many years ago, was I even in medical school? I think I was. I was working with this surgeon, and he's your typical surgeon, stereotypical surgeon. Surgeons are phenomenal people. I learned so much of my medicine from being around surgeons. But he kind of poo-pooed any kind of touchy-feely stuff. I don't need no good bedside manner. If they wake up alive, they'll be okay. And used to talk about all that psychiatry stuff, blah blah blah. But this man would not work on a single person if he thought they had depression. He would not touch them. He said, "Oh no, we're not doing that." I said, "Why?" Because the chance of recovery go down. I said, "So in other words, I'm just thinking back on how you poo-pooed all this other stuff, but in reality, it's real." Okay.
Wow.
So, the thing is that the point of that is that how we feel can manifest itself in many different ways. If you feel nervous, if you feel anxious enough, what happens to people? They get stomach upset, they throw up, their stomach, they'll even get diarrhea, all kinds of things like that. They get so nervous, they get short of breath, feel like they're going to pass out, they get lightheaded, get dizzy, get tunnel vision, their hands start getting numb and tingly. Those are all physical manifestations of a emotional condition, which elicits a physical problem.
And so do you find that people who experience that type of nervousness and have those symptoms then go on to say, "Oh, I have anxiety," but really they're just really nervous?
Well, people use these terms in a very catch-all phrase. They talk about anxiety, and I always ask people, describe to me
Yes.
what you're experiencing. And that's why sometimes I found out they actually had, a couple of people had some thyroid conditions, others had a cardiac condition. Some of them even, there wasn't one I know, but I know of someone who rarely had a cancer that was causing a secretion of epinephrine, which is the fight or flight hormone. So they, when it went out there, they were like, no. So they
Wow.
thought they had anxiety. But when it wasn't my patient, but when the doctor got a more longitudinal history, he said, something else going on here. So they took a look and found it. So that happens. So yes, I mean, people can become. Well, look at the African American communities, not community, because we ain't one community. You know, we have a large incidences of diabetes, high blood pressure, obesity. These kind of things can come about from extended exposure to stress hormones.
Ooh. Can you talk about that a little bit more? Because I don't think that that's an aspect that we actually cover when we begin to talk about the Black community. We'll fuss at them about their eating choices. We'll fuss at them about how they spend their money. We'll fuss at them about a lot of different things, but we never really address the stress that the Black communities are under. So can you talk about that, how that stress does that?
Well, I mean, now I'm not going to go into the biomedical
That's fine.
cascade that occurs, but suffice it to say that in general, Black folks are under enormous amount of stress, so much so that oftentimes we don't even realize it. It's just a normal state of being.
Wow.
Just being out here, being Black. Now you take your stereotypic person that's in let's take someone in the lower socioeconomic group, and this happens to white folks as well. It's just Black folks. But the signs of malnutrition in a developed country is obesity.
Oh.
The signs of malnutrition in an undeveloped country is starvation. So a lot of it has to do with diet. But now, what propagates the diet that you use? What propagates why you're doing the things you do? Because one of the things is comfort foods. Now, there's all kinds of reasons, but comfort foods help reduce stress hormones. So you feel better. Also, if you take something that's rich in carbohydrates, you get the itis and get sleepy. But a lot of that, why do people find such comfort? It's because they're not being comforted in other ways. That's not the only reason. You know, the food tastes good too. But you have that, you're under constant stress. And again, some of it is just like, you know, hey, I mean, I got to make sure I got to feed my kids. I got to keep the roof overhead. I got to keep my lights on. You know,
Right.
when you're working 3 jobs, nobody may be messing with you. The police may not have their knee on your neck. Nobody may be calling you the N-word, but you are trying to survive day to day in an uncertain environment.
Wow.
That's enough right there. Now add all these other things on. You know, half the time we don't even realize we're stressed until something happens. And you just snap. Oftentimes I see people, they come to my office, say, how you doing? And they'll just go for 2 or 3 minutes. It's in a tirade, just going off. And then I say, I'm sorry. I said, well, did you do this to the other doctors? No, I can't do that now. They don't understand. I said, okay, so I feel honored because I understand what you're doing. I understand why you're doing it. The question is, when you're done, I'm going to ask you, do you understand why you're doing it? And what can you do that you can feel better so you don't have to do this as often? Or you can release this tension in other ways. So it's multifactorial.
Yeah, I hear that, but I'm gonna be honest with you, Dr. Freeman. You're enlightening us here today because that's not something that's really talked about that much for us. It's huge. It's huge for us because stress is one of the things that wears your body down. It contributes to things like, you know, dehydration and other mental health issues, sleeplessness,
Lack of sleep.
Yeah,
Yes.
Right. All these things are attributed to the stress. And not only that, but then our body physically begins to break down when it's under a certain amount of stress for too long. So we know, in our psyche, we kind of know that there's something that's going on. Like we know we got a lot going on and we say it, oh, I got a lot going on. I got this, I got that, but not really sitting down with that. What are some ways that you would say would be good to help to begin to have an outlet for that so that we're not under that amount of pressure all the time?
The number one thing is to realize what's happening.
Mm-hmm.
That's the number one thing. It's not going to make it go away, but it makes you more aware of what's happening with you. Little things like, your shoulders might be up. You may have a stiff neck or something. You might be getting headaches. And I tell people, once you understand what's happening, sometimes that immediately lessens it. Doesn't make it go away, but because if you're not controlling it, it's controlling you.
Absolutely.
Now, other things. And there's really nothing necessarily wrong with our diet per se, but it may be not so much of certain things, not so much of the rich foods. A little exercise. You don't have to go do, PX90 or one of those things. You can just go walk. Because so many of our sisters have these wonderful hairdos, they don't want to mess their hair up.
I'm not gonna lie, Dr. Freeman, you tell the truth.
Hey, I understand, but if you don't sweat, if you don't get that heart rate up, if you don't get those muscles moving, then if you don't use them, you lose them.
You tell the truth. We've been quarantined now for 90 something days, I think. Maybe longer than that. Maybe
I think it's been about 6 years. I think it's
well, my husband decided that he didn't want us to gain a whole bunch of weight while we were doing this quarantine. So he made the family get out in the mornings about 7:30. We all meet in the garage and then we go walking for about 30 minutes every day, however long it takes us to get to about 2 miles. And so we walk every day. And my hairdresser, she's looking at me like, what are you doing? Why do you need to come back to me so often? And I have to let her know I'm sweating. So, my hair ain't keeping like it usually does. But I had to make that trade. I had to say that the exercise, the fresh air, the getting out of the monotony of the environment, the healthiness, the losing weight, all those things were so much more important than keeping my hair done. I can get my hair done later. But I need to be healthy, and getting out and changing up my environment, going from my house it's a small change to go from my house to walking around the neighborhood. But I noticed that when I don't do it, I feel bad. Like, it's like, oh my gosh, I really should have walked today. I don't know why I didn't get out there. And I feel bad, but who would have thought that just a 30-minute walk a day?
That releases endorphins. Endorphins are those good feeling, hormones that make you feel good. Now, there's certain drugs that release those too, and I ain't talking about them today. But hope you're taking notes on that. But exercise is good. And like you said, it doesn't have to be anything very strenuous, but it needs to be regular exercise. And there have been people that have talked about the relationship between hairstyles and maintenance of hairstyles and lack of exercise. And, again, who am I to tell somebody they need to mess with their hairdo? I am not. But I can tell you this. If you're not exercising, you're doing your body a great disservice. Period.
Right. So your hair will look good, but your body will be toe down at the end of it.
Casket clean if you ain't careful.
Oh, wow. Dr.
Same. We need to take care of ourselves. And in this COVID, and I have some pre-existing conditions myself. But the one thing that I did prior to COVID, I spent my lunch hour going to the gym and working out, and after you do it a while, like you said, you got to do it because you don't feel right if you don't. And I wasn't trying to become Lee Haney or one of them people, but I played with little weights and did this, but to try to keep my body in some condition, reasonable condition. Again, we don't have to be bodybuilders, but reasonable condition. We don't have to watch every ounce and every inch, but
Mhm.
just take care of yourself and give your mind and your body that change up. That's what it needs. It needs that. You can be. It's very stressful. Monotony can be extremely stressful. Here we are
Mhm.
stuck in the house for the last 368 days, and and that can be stressful. You go out and
Mhm.
go do something. It's like, oh hey, yeah, oh yeah, yeah, it feels good. Yeah, the mind, and the body's like, whoo, something different. Thank you.
Yeah.
So
Yeah, that's good. So, Dr. Freeman, we're almost at the point where we're getting ready to close. I want to give you a little bit of time to speak your last closing thoughts, some things that you want for our community to hear from you, some things that you think that are important, that kind of are in line with what we talked about today, that you know that they need to hear this before we get off this live. It'll impact their lives and it's on your heart. If you could just give us those closing comments there, that would be amazing.
well, the first thing I want to say is for all the people that I have treated, I want to thank you. I know I've gotten more out of this than any of y'all have ever gotten out of it. I know you have. And I want to thank you all for allowing me to do what I do. Because without you all allowing me to do this, I couldn't be who I am or do what I do. I thank God for that. And I thank God for you all. But now this is the gift that God has given us, the breath of life. We need to take it seriously.
Mm.
Let's take better care of ourselves. Let's loving each other a little bit better too. That's good too. That's a good exercise. Being kind to one another, you know, and get a little exercise. And ladies and some gentlemen, we might have to change our hairdos. You can just do like me. I just cut all mine off, but you might not want to do that. But taking care of our mind, body, and soul is so important. It's so important. This is a gift given to us, and this is not forever. But we've all been given this for a reason, and it's not just for us to keep for ourselves. It's to pass on. If it's no more than to your children and your other loved ones, let's do what we got to do so we can fulfill those things that God have given us. He's given us grace for a reason. He died for us for a reason. So please, let's just be a little more thoughtful about ourselves and others. Okay.
Amen. Dr. Freeman, thank you so much again for gracing us with your presence on this evening, for coming back to talk to us. I know that you have an amazing schedule. So for you to be able to fit us in for this hour talk. I really, really appreciate your time. I appreciate your wisdom. I appreciate your candidness. And most of all, I appreciate your obedience to God, because the bottom line is that it's very difficult a lot of times to find a provider or a physician who actually does believe in God. It's much less rare to find someone who would that's a physician that believes in God that will talk about it as far as the body is concerned. So thank you so much for just being available to us and for giving us your wisdom and your thoughts. It's always been a pleasure to be able to talk with you. I'm so thankful that the people who joined us did join us on this evening. If you are on with us right now and you have not liked our Facebook page yet or subscribed to our YouTube channel, please do. We are Prison Break with Shirley and Shonda. You don't want to miss. We're definitely going to have Dr. Freeman back on again. I don't know when, because we got to make our schedules match up. But if he'll allow us to keep inviting him, then we're going to keep inviting him, because he is a wealth of knowledge to the body, and he is a wealth of knowledge to the Black communities. And we're so grateful.
All the communities.
All the communities. We're so grateful to be connected with him. So you have been watching Prison Break with Shirley and Shonda's special edition, a psychiatric talk with Dr. Edward Freeman Sr., MD. And we are so grateful, sir. Do you have
Thank
anything
you.
else
Thank you
you'd like
all.
to share?
God bless everybody. Just everybody. And be careful out there. COVID is real, people. COVID is very real. Be careful.
Amen. And so if you missed our talk with him the last time, we kind of talked a little bit about his recovery from COVID-19 and what he experienced during that time. So you could catch those replays on the Prison Break with Shirley and Shonda Facebook page, or you can go into our Facebook page and find that video. You can also go to our YouTube channel. You don't want to miss what we have next for you guys. I'm so grateful to be able to broadcast with you all on this evening. So thank you for this time, and God bless you all, and have a good night.
Take care.